AFib, otherwise known as atrial fibrillation, is an irregular heartbeat that your heart experiences. It's oftentimes very rapid and it's not timed properly, it's not synchronized. So the top chambers of the heart, the atria, which are basically here, they kind of beat unsynchronized. And what that can lead to is clot formation in the heart. And if that clot is then projected to the brain, you can have a stroke. Common symptoms of atrial fibrillation typically is maybe feeling heart palpitations. If it goes into a condition where it beats very rapidly, something we call rapid ventricular rate, patient can feel lightheaded, dizzy, low blood pressure, and feel like they want to pass out. It can be tricky to differentiate this from another medical condition or tachycardia or supraventricular tachycardia. And the main way we distinguish this is through an EKG. So the causes of atrial fibrillation, there can be several of them, both metabolic and structural. There's non-valvular atrial fibrillation, and that's where the heart's timing mechanism, its natural pacemaker is just not working properly and is firing unsynchronized, causing the atrial fibrillation. There can be valvular atrial fibrillation where the valves have pathology not working well and can cause the heart to beat irregular. There's also metabolic disorders such as thyroid disorders, and to another degree, smoking, uncontrolled blood pressure, even age can be a risk factor for atrial fibrillation. So if we see a patient that is feeling palpitations and perhaps short of breath, lightheaded, dizzy, the first thing we typically do is an EKG. And an EKG can very conclusively tell us if a person has atrial fibrillation. There are a couple of different types of atrial fibrillation. There can be paroxysmal, which means it comes and goes, and there can be chronic or permanent atrial fibrillation. So sometimes these patients have the symptoms, the EKG is normal. We can consider other tests like a Holter monitor, which records the heartbeat over one day up to a week or even 2 weeks. And sometimes in the middle of the night, they go into atrial fibrillation and we catch it then. So that would be the main way. Other tests can catch it too. If you do an echocardiogram, an echocardiogram can show that the atria are in atrial fibrillation. So management of atrial fibrillation, what a patient can do is if they have uncontrolled blood pressure or thyroid disorder, those things mainly they should control them. If they take any stimulants such as smoking or sometimes decongestants can do it, we should stop those things. Now the treatment options, it kind of depends on the degree of atrial fibrillation. If it's not very frequent, maybe we'll suggest a blood thinner, baby aspirin a day, something like that. But if it's more continuous, there's medications that can help. A blood thinner such as Eliquis that you've heard of probably, something that we used to use, Coumadin, Xarelto. Those thin the blood and help limit the formation of a blood clot significantly, which reduces your chance of stroke. We often use another medication in conjunction, something called a beta blocker, like perhaps metoprolol, which slows the heart rate down so you don't go into tachycardia and keep the rate controlled. There are other things that can be done by a cardiology specialist, electrophysiologist, cardioversion, shock the heart to get it back into its normal rhythm. And ultimately, there is something called a Watchman procedure, which helps prevent blood clots and strokes. So there are medications to help, and there are lifestyle management that can also help.